Welcome to episode 7 of our Diabetes Health Matters webinar series. My name is Dr. Joan St. John and I'm the host of this series. I'm delighted to welcome Debbie Musendeki, who is the Obesity and Bariatric Clinical Nurse Lead at Luton and Dunstable NHS Foundation Hospital Trust. Debbie is passionate about improving the health of people living with obesity, and particularly those of African Caribbean heritage. So we're really looking forward to all that Debbie's going to share with us. This webinar series is sponsored by Eli Lilly and Company, although they have no input into the content of the series. So as you know, you've got to stay active in that chat, ask lots and lots of questions, and we'll have our Q&A at the end of Debbie's presentation. So look forward to hearing what Debbie has to say. Thank you, Debbie. Welcome, Debbie. It's absolutely fantastic to have you join us. There's so much for us to learn about the conditions of obesity and diabetes and the interaction between the two of them. And you're going to focus particularly on African Caribbean heritage populations. So Debbie, welcome. And I'm going to hand over to you and we're going to talk about these really, really important topics.
Thank you. Thank you so much. Really thrilled to be here, and really excited about the conversations that we are going to have, because I think it is a very topical subject. So we'll get straight into it. So I am an obesity specialist nurse at the Luton and Dunstable Hospital. I am the lead nurse at the hospital, and we are one of the largest centres in UK, I think, yes. Okay, so what we'll hope to cover is the scope of the problem, and then briefly discuss the causes and consequences. We talk really briefly on the benefits of weight loss and how much weight loss you actually need to have some of these positive outcomes. Just a general update on where Africa and some of the upcoming countries they used to be called developing regions, where we are at with regards to obesity and diabetes, and then just coming back home and looking at the United Kingdom. We just wanted to emphasize our points today by briefly looking at Luton and Dunstable Hospital. Okay, so we'll start with diabetes and obesity. World Health Organization defined obesity as chronic, multifactorial, complex, relapsing, and progressive disease. And the other definitions is that obviously obesity is accumulation of fat in areas where it will cause risk. And so it comes with a lot of metabolic syndrome, a lot of metabolic conditions such as high blood pressure and so forth, which we will discuss a little further in the slides. And also when we look at diabetes, as we know now, there are more than two types of diabetes, but we'll focus on two. So type 1 diabetes, we know that is when the pancreas is not able to produce any insulin to deal with the glucose in the bloodstream. And this is usually diagnosed at a very early age. Type 2 diabetes, a lot of World Health Organization calls it a lifestyle disease, and it is reversible, whereas type 1 isn't. And type 2 is an issue of insulin resistance, or having too much insulin in the body system. Again, we will discuss a little bit more further as we continue with the slides.
And Debbie, I think we almost need to pause there, because one of the things that we've learned as healthcare professionals, and maybe in the general population as well, is obesity is a condition. Obesity you described as a disease. And previously, I think people used to just think it was not a condition, not a disease. So already that's something that people need to get their heads around, maybe something that they hadn't realised before. And that interplay between obesity and the different types of diabetes, those two main types, type 1 and type 2, which you're going to draw out as you continue to share information with us. There's so many questions. I'm going to let you get on, Debbie, because, the tendency is I'm going to ask you lots and lots of questions, and I know everybody's going to be so active in the chat asking lots of questions as well.
Yeah, absolutely. And it is a chronic disease. The World Health Organization have defined it as a chronic disease, and as such, it deserves proper treatment pathways. Obviously, we are still to come to that knowledge as the public sector, but it's not, we don't see it as a disease or a problem of willpower anymore. So yeah, it would be good to have that conversation as we continue. Yeah. The other area we can talk about is living with obesity and type 1 diabetes. Yes, that is possible, because we know once people are, usually type 1 is treated with insulin, and once you start insulin, there's a weight gain, and there is a problem amongst the youngsters called bulimia, when they withdraw the insulin and they eat as much as they want and they don't gain weight. So yes, if you're type 1, doesn't automatically mean that you're not going to have obesity, but having type 2 and without obesity is very possible as well, although very, very, very small percentage. But we will have more conversations.
Yeah, absolutely, because again, two startling things perhaps for some people, that you can be living with type 1 diabetes and also alongside that be living with obesity, and you can have living with type 2 diabetes and not be living with obesity. So yeah, fascinating, isn't it? The interplay between the two. Thanks, Debbie.
No worries. So we've already discussed this briefly, and this slide is from the World Health Organization, 2022. The figures there are quite concerning. So we're looking at a population 5.3 billion people living with obesity, and that's probably nearly 1 in 6 people that are living with obesity. So it is a subject that we need health level, individual level, national level, really need to be addressing, because these figures will pose an economic problem on the government, on the NHS. So we do need to be having conversations about it.
And that's not omitting the impact it has on the individual, on their family, on their community as well, living with this condition.
Absolutely. And the impact, as you mentioned, is really important, because we know that living with obesity means that you are likely to be having high blood pressure, you're likely to have diabetes, you're likely to have kidney disease, which is very prominent within the ethnic minorities, mainly Black ethnicities. You're likely to have musculoskeletal problems on your joints, and even mental health, infertility. The list goes on and on and on. So the impact on an individual's health, the impact on the National Health Service is quite enormous and very concerning as well. Yeah. So there was a statement that I really thought was worrying, and it says that the number of deaths from obesity is far greater than the deaths of people who are struggling with starvation. And that's food for thought, isn't it?
Wow. When we look globally, that is really concerning, isn't it?
This is from the UN, and they said that prediction there will be an increase of 250%, especially in Africa, and so it was quite interesting. World Health Organization sort of put a prediction for the next 25 years, and Africa is within the first two, number 1 and number 2 areas, with the most rapid growth of obesity. And again, we can't sort of ignore that, because we're in England, because there's global migration. So we are having people moving around, and these people are likely to be coming here for some reason or the other. So it's not something that we just put a blind eye to.
And for global health as well, I mean, South America, the Caribbean is number 5 there. We've got North and Sub-Saharan Africa as 1 and 2. So it's that they're expecting quite a phenomenal increase in the rate of people who are going to be living with obesity. So for global health, it's really important as well. Thanks, Debbie.
Absolutely. So the United Kingdom and the United States of America have sort of gone down the ladder of these predictions, not just because that we're doing well with our figures, but it's actually that the other countries are taking over in the rapid growth. So that's another interesting point to look at. And within the United Kingdom, we are the highest rate. We have the highest rates of obesity, and which is really sad is that we have the fastest growing childhood obesity. I know the government has strategies that they want to halve that figure by 2030, but who knows, where we stand with NHS England at the moment. But these are scary figures that in Europe, UK has the highest rates of obesity.
And that childhood obesity, how shall I say, so rapid rise as well. It's a tragedy that's sort of stored up for the future. It is a tragedy.
Absolutely. We are getting children, teenagers, for example, that are being referred to weight loss services, and you're getting teenagers that have high blood pressure problems. You're getting teenagers with chronic kidney disease. And these kind of conditions used to be many years ago, used to be diseases of the elderly, not the young ones. So it is concerning, and we need to sort of deal with it at that level to start off with. London is one of the top cities in the world, and we've got 57% of people living with obesity in London. So again, another big concern. Within the UK ethnicity, looking at obesity amongst different ethnicities, I wanted to highlight, and I put it in red, the Black population, and you are looking at 70% of this population are people living with obesity. And as we said earlier, when you're living with obesity, you're likely to have a metabolic syndrome problem, one or the other. So you're looking at a very high percentage of people that are almost a ticking bomb for some disease or the other.
And Debbie, I can see those questions coming. It's our big bones, okay? And how are they measuring it? And how are they comparing us? So I'm asking you to answer those questions because they're just going to be coming in, bombarding us. And, we know that people are going to be questioning, why is it so high? Why are Black populations the highest? What can you share with us, Debbie?
All right. So before we sort of start asking those questions, it's really good to know the causes of obesity. And remember earlier on, we were defining it as a disease. We know that it causes a lot of metabolic issues, and some of those metabolic or lifestyle choices. So when we look at these causes, the most easiest is dietary. We are living in an era of plenty. Okay, so at 3 a.m. if you're up, you can literally Uber some food. There's excess eating, there's excess alcohol intake. We're being told to constantly eat 6-7 meals a day. We are constantly on eating, and we're also bombarded by ultra processed foods, which is not going to be very helpful when we talk about insulin resistance. So again, it's a type of diet that we are exposed to, and our lifestyle. We're very busy, we're very sedentary, and we've got poor sleeping hygiene because we're so busy. We want to achieve so much, we only sleep very little, and sleep is a big component of contributing factor to obesity. And then there's comfort eating. We eat when we're happy. We eat when we're sad. We eat when we meet friends. We eat after work. So that doesn't really help. And then obviously there are some health factors that also contribute to obesity. So if someone has an autoimmune condition and they're put on steroids, that's going to boost their obesity. Someone who suffers from PCOS or someone who's got low hypothyroidism, that's going to boost their obesity as well. And then there are genetic factors. Now we are in a very exciting era, especially in my department. We do genetic screening because we want to know whether there are fatty genes involved. Not because it does give people an aha moment that actually it's not me. I don't have a lack of willpower, but something in my biology is contributing to the obesity.
That's fascinating, because people want to know the reason why. I mean, I think most people who are living with this condition, or a lot of people who are living with this condition, who want to do something about it, want to know the underlying cause. And it'd be fascinating, won't it, if we are able to identify genes related to it, particularly that red line, Debbie, is sticking in my head, that 70% for Black populations, yeah? So it would be just wonderful if in the future we were able to identify more specifically things like genetics, things like genes that are involved in this, to help those who want to address this condition. Thanks very much, Debbie.
Absolutely. And it's good that we are living in that time where we can actually do it. But the issue is we need the patients to come. They need to access the service. They need to be aware that the service is available. So this slide is really positive. We're talking about positive outcomes. We're talking, it's not all doom and gloom. So what is really important to notice on this slide is that only 5 to 10% of weight loss will warrant a lot of reduction or have positive outcomes on the medical conditions. So you lose 5%, your diabetes already starts taking a backward trajectory, which is really positive, and you carry on, you might end up in remission, especially with type 2 diabetes. And especially if you've been diagnosed 10 years or less, that tends to go into remission. Blood pressure, again, that tends to take a backward trajectory. We have seen a lot of people, women that will lose 10%, and they were waiting for fertility treatment, and boom, so they lose weight and their fertility goes up, and they don't need those the artificial support any longer. So there's a lot of positive outcomes from just losing 5 to 10% of one's weight.
And big question here. Okay, first of all, let's say, you're 11 stone, about 70 kilos. You lose 7 kilos, 10%. You lose 3.5 kilos, half a stone, yeah, equivalent. You're still going to get some major benefits.
Absolutely.
It sounds wonderful. It sounds great. How do you do it?
Okay, that's where you and I come in later on. But it is possible, and we just want to let people who are listening that it is possible, and it's not all despair. There is hope, and once you see, the brain works on reward system. Once you see that little reward, you see your diabetes figures going down, it rewards you to keep going. And we can talk about some of the ways you can lose weight.
Yeah. Excellent, thank you. Debbie, lots of questions have come up. Can I ask you some of them? I want to know, first of all, what would you say, which comes first, type 2 diabetes or obesity?
So, and from a lot of evidence, type 2 diabetes, pre-diabetes, when you're still pre-diabetic, that can happen for many years. Things are happening in the background, and because you're insulin resistant, then you're probably having more intake in terms of caloric food. So it's a chicken and egg scenario. But there are loads of scholars that actually say it's a metabolic syndrome that causes obesity, and other people say, well, the obesity then introduces the metabolic. So it depends which angle you want to take it, but it is an egg and chicken scenario.
It absolutely is. And the other thing that you have to add into that, which science is helping us with, is that each of us appears to have a personal obesity level. Can I put it like that? So that for an individual, there is a sort of critical level at which your metabolic syndrome, your insulin resistance will kick in. So a particular level of obesity, if I can call it that, at which those things will kick in, then triggering those other issues that you've said were consequences of those conditions of obesity and diabetes. So things like high blood pressure, what we call cardiovascular ill health as well. So it's a complex, multifactorial condition and interplay, which science is helping us with, but we're not there yet. We're getting more knowledge, but we're not there yet.
Yeah, we now understand a little bit more than we did before, especially with the complexities of both disease, the obesity and diabetes. They were calling it diabesity because they were sort of combining the two because of this complex nature.
I don't think people, people may not have heard that term before. Diabesity.
Yeah.
I mean, I describe them as cousins. I think
they're very good cousins.
There's a sort of commonality between the two, although they are separate conditions. And this is what we're saying. So one of the things I want to ask you, and you can address this now or address this in the Q&A later. If you're living with diabetes, can it make weight loss more challenging, do you think?
It goes back to the lifestyle. And remember, we say type 2 diabetes is not a life sentence. It's reversible. It's a life, almost, it falls in that lifestyle category. It goes back to the lifestyle. Yes, you can lose weight with diabetes, but then that will have a positive impact on the diabetes as well.
Yeah. Okay. So
we'll diabetes make weight loss more challenging. Well, no. If we focus, if we support our patients with the right tools, and we give them sort of have conversations about the right lifestyle, sleep hygiene. No, it's not difficult, because the weight loss will then impact positively on the diabetes.
And also, I think, I want to pick up on a point that you've made there. As healthcare professionals, we can positively impact this in terms of assisting people, sometimes with actually the medications that we use. Some diabetes medications we know can cause weight gain. Some of them help with weight loss. Others are weight neutral. Would you like to say a little bit more about that?
There are medications. So with diabetes, we've got new medicines at the moment that are causing world havoc, but they're very effective, especially with the right kind of support. So we're talking about GLP-1 analogs. They're used for both diabetes and obesity. The only difference is the dose. The doses for both are different. You tend to have higher doses with the obesity than with the diabetes. But yes, we can talk about that. So there's lots of treatment for diabetes, but there's also lots of treatment for obesity as well. Not only the injectables, but we're also talking about support with lifestyle changes, behavioral changes, psychological support, but the sort of ultimate one is bariatric surgery.
Okay, I know that there'll be lots of questions, Debbie, so we'll address it in the Q&A. Thanks so much.
No worries. So this was a case study of Luton and Dunstable Hospital area, just to highlight that in an area where you have so many ethnicities, only if we go to the next slide, only 7% are accessing the health that care that they need. This is mind-blowing. Okay, so you're talking, wow. If I just go back, so you're talking about 32 major ethnicities, and of all those, only 7% are accessing our service.
Wow. So that's a huge underrepresentation, is what you're saying.
Yes.
Can you tell us why?
So, yes, because I'll come back to that slide, because the first one I think is the reason is lack of awareness, but it's also the significant perceptions that we have on weight. So especially, I'm generalizing here, but especially from the African heritage, if you're carrying weight, then it's a sign of beauty and well-to-do. But what I'm saying is, if you're curvaceous and so forth, you're seen to be accepted beauty-wise and well-to-do. So it's those misconceptions that will hinder us from accessing health. And another point is that it's a lack of understanding of the impact of that weight on our health. I suppose we're not talking enough about it. We're not addressing the issue when a person sees their GP and they're giving them another prescription for blood pressure. We're not addressing actually the blood pressure has been affected by this, just to help this cohort of patients to get a better, a different insight, to change core values that actually this is going to impact on my health.
Well, I've got 1,000 questions going on in my head of what people have said to me previously. And I know it'll come in the Q&A, and I'm just going to highlight it, because people then turn around and say, well, they're saying everything is about my weight. Yeah. So whether I come in with a sore toenail, somebody brings it round to my weight. And I think it's so important for us to raise awareness of how this disease condition of obesity can impact all of your health. Yeah. So that sore toe or that sore arm or that musculoskeletal problem might be related to your health. But how do you do that sensitively? And how do you do that culturally sensitively? What can you give us?
Yeah, I think it's really important for us to acknowledge, as clinicians, that this is a disease, and as a disease, we should talk about it the same way we would talk about diabetes or high blood pressure. So yes, we need to be sensitive, and we can't use words or statements or fat shaming, and we can't go on the extreme where everything is weight related. I say to some of my patients, you might have a knife stuck in your arm and they will say, go and lose weight first. We can't go on that extreme. We have to, work with the individuals. Yes, your weight has an impact on what's happening. Are you happy for us to talk about it? Are you happy for us to refer you on? Is it something you want us to talk about? Give them an opportunity to think about it and say, okay, so the issue is, if we don't work on your weight, your diabetes, you're already on 200 units of insulin. I'm exaggerating. So if we continue for the next 5 years, where do you see yourself? Talk on the medical aspects of things, address from a health perspective, instead of, you ought to lose a little bit of weight. You would look better, because that has a person will receive that differently.
Absolutely. And I think outside of health, no, I don't want to say outside of health, because this is part of health, but outside of the health setting, we need to all talk more about this disease condition called obesity, and what impacts it might have. So then it becomes normalized to talk about this disease condition. And it's not something that the person feels there's a stigma about, and the person then doesn't make use of services like yourself, where there is something that can be done if you want to do something about it. As I say, so many questions, Debbie. I shouldn't interrupt you anymore. You go ahead.
Yeah. So the positive things that people can do is definitely seek help, speak to your GP, because they can refer you. They don't need to be the experts in this area. They can refer you on. There's a lot of government initiatives at the moment when it comes to diabetes and obesity. There's a lot of programs, diabetes prevention programs. There's a lot. So we want to catch it at pre-diabetic stage, and once you learn those lessons, they will also positively impact on your obesity. So there are a lot of government initiatives, a lot of local authorities have a lot of programs going. I know in Luton we have Luton Active, but there's a lot on the website as well. So it's just taking time out and prioritizing your health and sort of looking for that information, but it is available.
And okay, so I'm going to ask you, as an individual, how do you take that that aim that you have now to prioritise your health and do something about it, to the healthcare professional? Because that can be quite daunting. And I'm then going to ask you, as a healthcare professional, how to culturally, sensitively, and with humility address these questions. But as an individual, how would you best approach a healthcare professional as an individual?
If I was an individual, I think it's just to tell them how the difficulties that you are having now with your weight. So simple things like if you're going to see your GP, let's say a 50-year-old woman, menopausal, you're constantly talking to your GP because your menopause is causing havoc. That's also a good time to talk about, because the weight is going to be on an upward trajectory. Listen, I'm really struggling with my weight. I find I'm breathless. What can I do? I can't emphasize enough taking ownership of your own health, because if left for more years, like we said in the definition of obesity, is a progressive disease. It will cause havoc. So it is taking ownership. Whilst we're visiting our practice nurse about our asthma checks, about everything else, let's feel empowered to say, listen, what can I do about my weight? I've tried Slimming World. I've tried Weight Watchers. What do you suggest? Do you have any suggestions? And if I was a healthcare professional, then I would say, yeah, I'm going to refer you on, because there is services around. I don't have to be an expert, but I know an expert.
And in terms of cultural awareness, cultural humility, cultural sensitivity as a healthcare professional, you've given us some tips already. Just summarise that for us. How do you address that then? So it's not the person initiating it, it's you as a healthcare professional.
That's a really good question. Yeah, thank you. That's a really good question. So a lot of the times people feel that if I tell you, you might not understand where I'm coming from, because you are not of my heritage and you might not see things the way I see them. So the safest neutral ground to deal with that without causing any issues in terms of culture and so forth, and being construed, is just to talk on the health matters. Treat weight as a disease, not and then talk about the impact that it's having, but also highlight on the positives that one can have with weight loss. And like I said, we're not asking everyone to be a size 0. So 5 to 10%, you will have positive outcomes. So for some women who still want to be curvaceous, yes, we want to talk about, you know what, we're not asking you to lose all your weight, but this is what you need to reverse your diabetes. And I suppose it also, we haven't mentioned this, Joe, but then it's about where you're carrying the weight. So people don't realize that if you're carrying it around your tummy area, that is where, or your stomach, your stomach abdominal area, that is the problem. Obesity, we call it central obesity, or other people will say visceral fat, because your organs are being affected. But if you're having a bad backside or size, that's not really going to give you diabetes as such. But if the weight is around, so those are conversations to have with somebody, to say, look, I understand you want to have this, but let's work on how to reduce your central obesity, because that's where the danger is. So also highlighting that.
Yeah. So waist circumference is going to come into this, and I think we can address it in the question and answer as well. Body mass index, what that is, how we measure it. In terms of Black populations, what are we talking about here? Are we talking about the same as with other populations? So we will draw that out in the question and answer. So any final tips that you wanted to give us, Debbie?
I think that we should the take home message is that obesity is a chronic disease, and as such, we treat it. It's not people lacking willpower. It's got nothing to do with that. Yes, a little bit, but the majority is that it's a chronic disease. It's a metabolic disease. It's an inflammation disease. It's a disease based on insulin resistance. So we need to curb our judgments when it comes to this disease. It is a disease, and let's look at it that way.
Excellent point to end on. Before we start again with answering lots of questions, Debbie, absolutely amazing. Thank you so much.
Thank you.